right, here we go. Welcome, everyone, to the Mid-Level Show. We are so excited to be back this week. As you may know, a quick description of what this show is all about. Every week, Dr. Rogers puts out a doctor's note and a Dictations podcast. And on this show, we get our team, we get the people inside of the performance medicine's offices who are seeing patients, and we go over that note to give you guys, the audience, different perspectives. We dive a little bit deeper. We see where maybe things that stood out to us, things like that. So this week it was on the book Breath by James Nestor, which was a really interesting subject and something that I know Dr. Rogers has been thinking a lot about for a while now, and we just decided to start talking about it. So I kind of just want first impressions from you guys, and I'll start with Amber. You know, we talked a little bit before about some of the dealings you've had with your kids, because there was something in the note about facial structures, bone structures. What was kind of your key takeaway in terms of just practical use in your own home?
Well, this was a new concept to me in some ways. My only history with this whole breathing idea was my husband's uncle is a dentist in Nashville. And so we've had several conversations about mouth breathing and its association with sleep apnea, and for kids, even like ADD and other, because of oxygenation to the brain. And you have so much better oxygenation when you're breathing through your nose than your mouth. And even kids who are waking up in the night, if they're waking up at the same time, they may be experiencing a type of apnea from breathing with their mouth open. So taking that with Dr. Rogers, I literally was in my kids' rooms last night before bed, like getting really close and, seeing if their mouth was closed, like if their mouth was open, like putting my hand in front, because what are the next steps? And there actually are, if your kid's a mouth breather, there's lots of them, not a ton in our area, Kingsport, but not too far off, where there's, it's like an occupational therapy type ordeal to, if you are concerned about your kid being a mouth breather, because it's been associated with certain complications down the road. So it's something to consider and to look into.
Kara, what's your thoughts? Amber just mentioned sleep apnea, and I know Dr. Rogers mentioned this as being something that could be a replacement for getting on a CPAP. What was some things you took away from it, Kara?
Well, I think Amber brings up a good point about the mouth breathing versus nose breathing. Patients with allergies, nasal congestion, they have a difficult time breathing through their nose. And so it's very important to manage your allergies. Snoring is another thing to be aware of. So just to add on to what Amber was saying.
That's interesting. I just have to ask you, Kara, because I know Dr. Rogers is in your office today. What's the craziness level over there? How you doing with Dr. Rogers in the Knoxville office today?
Actually, it's been great. He's in with the patient right now, and there's another one waiting, but never a dull moment here for sure.
That's right. That's right. And Fran knows all about that, being in the Johnson City office. Fran, you mentioned before we started recording the fascination you had with the correlation the book talks about with nose breathing and weight loss. Just give me your quick thoughts on that. I don't think it's a quick fix, but man, that would be super cool if you could breathe off weight.
Yeah, I mean, I was just kind of shocked to read that he was saying that you need carbon dioxide. The more carbon dioxide you're getting, I think, rid of. He said that's actually how you lose weight, and so that it's more of a lung function than anything else. And I just thought that was kind of fascinating. I've never looked at weight loss that way before in my life. But it makes sense because, when you go to yoga, people lose weight and you do all that deep breathing. So I think it's fascinating.
Yeah, I really, the thing that caught me was the idea that retaining carbon dioxide being a good thing. So he talks about, oxygen is life. We breathe in oxygen and then we breathe out carbon dioxide. and retaining that and keeping that inside is actually. He talks about it being a hormone, and Andy, why don't you jump in there? Did you realize that carbon dioxide was a hormone? Because I certainly didn't.
No, not at all. No, all definitely new to me. Hormones send signals and make changes to receptors. And so definitely new to me on the carbon dioxide thing. I do agree with Fran, though. When we think about yoga, slow breathing, losing weight, being centered, having mindfulness. I actually was trying to read up on this. This is something that I didn't know a ton about. And we often ask our patients in the room, hey, how's your gut doing? I have not once in a year of practice said, how is your breathing? Do you breathe slowly? And that's something that I'm going to implement now in the room. But I found too that this has been a long studied practice. If you think about incantations with monks, and they do those really long, like incantations where they take one big breath and spit out a bunch of words. That's practicing slow breathing. That to me, they said that they may have been ahead of their time with just how useful the technique of slow breathing is. And it stimulates the vagus nerve right here in the chest. And the vagus nerve stimulates rest and digest. The more we expand and the slower, a basal nerve massage, a vagal massage, or vasovagaling is decreasing your blood pressure, decreasing your heart rate. For most of us, that's a good thing. So that's something that I'll definitely start asking about in the room. I thought this is a great note.
Yeah, that's interesting. You said that about the blood pressure. And, one of the comments we got on Facebook as we're starting to push this piece of content out was, does this idea of nose breathing help with anxiety? And that's been the probably the thing that's that I've noticed the most, because I've been trying to practice nose breathing while exercising and while just trying to be aware of it, to be honest. And I've noticed much less tightening of the chest, and the idea of less breath has really helped me in a weird way. I don't know, Amber, what's your thoughts on that in terms of when somebody's coming in for hormones, or just experiencing the type of thing that we see? How do you think this breath stuff relates to that? In just an everyday kind of situation.
Well, do you know how long 5.5 seconds is? Because when he said, I was thinking, I pushed start, I'm like, it's only 3 seconds. Okay, it's been 5 seconds. And then you breathe out. And I can do it, but you have to be extremely conscious of it. And definitely not in my everyday, or in I would say the average patient's every day, do we slow down enough to really focus on breathing. And when you do that, because a lot of the patients we see are stressed, whether we're seeing them for hormones or blood pressure or whatever we're doing. And so really focusing on their breathing and slowing down, and even setting a timer and practicing 5 seconds, 5.5, it's going to make you slow down in other ways too, help decrease stress, focusing on that breathing and really slowing down to focus on that is beneficial.
Kara, with your background in allergy and sinuses, is that something that you've talked to patients about in terms of sinuses? The way I took it was that you can actually open up your nasal passageways by just focusing on breathing through your nose. What's your thoughts on that, just based on the experience you have with allergy?
Well, there are different things that can cause difficulty breathing through your nose. It can be just the way you're made. Sometimes it's somebody's anatomy. It can be a previous injury, maybe playing softball or baseball when they were younger. And so sometimes it's structural, where they can't breathe through their nose very well. And so it's just really an evaluation of making sure that their nose is patent and that they are able to take deep breaths. We can also use nose spray for that, and just manage allergies better. It's also breathing's also important for asthmatic patients. This for them that have trouble breathing, and especially everybody's been wearing a mask now, and so I think it's important for everybody.
Yeah, I do find it fascinating what was mentioned in the book about being able to reverse asthma by focusing on nose breathing, and I get that really interests me. Anything that's within my control. Fran, what do you think? There was a quote that he mentioned in this note that's from the book about you can eat right, you can exercise right, you can do all these things, but if you're not breathing properly, you're not going to get the full benefit. When you read that, did your eyes widen? Like, what was your thoughts about that?
It's like, oh no, one more thing I have to do. Now I have to breathe right too. So all day long I'm thinking, oh my gosh, I'm a mouth breather. Oh no. Like last night I woke up in the middle of the night. I'm like, I'm breathing through my mouth. So one more thing to worry about that I need to correct. But I am fascinated by, I think I have used this technique in doctor's offices because I tend to get white coat hypertension, and my blood pressure is always through the roof, and I know I can control it by sitting down and breathing. And I think maybe we should be incorporating that when we get a high reading on someone and they want to bring it down. Nobody wants their blood pressure high. Before you jump to medication, just give them the exercise. Let's have you sit here for 5 minutes and breathe, and then let's take it again. And it just shows you the control that you have. When you take that second blood pressure.
Have you heard of? I'm sure you guys have. It's called the white coat blood pressure reading or whatever. I'll never forget.
Yeah.
I think I told Kara about this because I just came from the dentist to the office, and the dentist, before I got a teeth cleaning, they took my blood pressure, and my blood pressure was through the roof. And Andy knows this, that I have I don't think it's a healthy fear, but a fear of the dentist. And taking the blood pressure right before someone's getting ready to clean my teeth is not a good idea. But I found that interesting. Andy, what's your thoughts on that? You mentioned blood pressure before. It seems like you might actually get more out of the visit if you can get somebody more relaxed just through their breathing.
Yeah, and two, Ben, we got to work on this dentist thing with you, okay? The dentist is your friend. You've got cleanings more than once every 3 years. Maybe you won't be as scared, okay? I think that's a you thing.
That's true. It's definitely a Ben thing. It is a Ben problem.
Oh, they're trying to help you. They're not trying to hurt you. Fish are friends, not food, okay? I think I forgot your question, Ben.
Well, you mentioned blood pressure, and Fran was talking about just it might be helpful in a visit, before you judge that first reading to I guess explain to them some of these breathing techniques that could bring it down. It could give you a more accurate idea of where their health is at, and it's not just because they're at performance medicine getting ready to get a visit. It could be altered just based on the situation.
Yes, white coat hypertension happens all the time, but I think it's going back to basics. I think you make a great point, Fran. It's breathing. One more thing I have to worry about. It's like that's something we do upwards of. I think I read it's like 23,000 times. Like I think that's that, but we breathe a lot and take it for granted. And if you maximize, that is one thing too, where patients are like, thyroid's not in my control, hormones aren't in my control, my diabetes is not in my control. Breathing is definitely in your control. Then unless we're on a ventilator, I would say it's in everyone's control. So that is something we can all practice literally right now. And two, it bringing it back to mindfulness and this mind, body, spirit thing. I think it has way more benefits than just lowering blood pressure for that particular reading. But you're right. We should be conscious of giving patients enough time in the room. How sped through doctors' offices. I mean, we're sped through them. So it's something practical.
Yeah, I think the big thing I took away is like you said, Andy, just the sense of control that we have over our breathing and the impact it could have on our overall health. If it's going to make everything work better for me, and it's something that I can practice every day. Kara, you might want to coach everybody in the Knoxville office today with Dad being there. Breathe 5.5 seconds in, 5.5 seconds in.
And tying into what he will
Say that
talk
one.
about
Say that one more.
medications.
Hold on 1 second, Carrie. You broke up 1 second. Go back and say what
Sorry.
you were saying.
So tying into what Andy said about mindfulness, Dr. Rogers will talk about meditation, and he'll talk about yoga and this biofeedback, which I think, we've been referring to. So those are all things that really get us to focus on where we are and focus on our breathing and relaxation and things like that. So all those can be used too with the white coat that we've been talking about.
And it's interesting how it all kind of ties back to hormones. Carbon dioxide acting and being a hormone, and hormones being what we specialize in. Like, it's fascinating the role hormones play in our overall health. I know it's a huge reason why you guys are working here and kind of spreading this message to all of our patients. But the impact is just unbelievable. And so we're going to have to wrap up here in the next couple of minutes. Let's do one quick rundown. Amber, what's your final takeaway from this note for the listeners out there?
Just focus on your breathing and be mindful of how you're breathing and slow down.
Slow down. I like it. Kara, what's your final takeaway?
I agree with Amber about just being able to focus on your breathing and mindfulness too. I agree.
Fran, what's your thoughts? Final thoughts on the doctor's note with the weight loss correlation? What do you think?
Just one more thing, that so much of your health actually is in your control, and there are things you can do to move in the right direction. So come into performance medicine. We'll test whatever we can and try to get you moving in the right direction with your health.
Love it. I love it. Andy,
Could be something as simple as breathing.
That's right. Andy, what's your final takeaway?
I agree with what everyone's just said too. We notice like slow breathing, but breathing through your nose is a filter. It's meant to be filtering the things that are going through your mouth. Is meant to be eating, even though it connects to the bronchial tubes going into your lungs. It's mainly for the esophagus going down into your stomach. So breathing through your nose is a filter. That's a good thing. But I have a timer. I think we should all breathe in for 5 seconds and see how long it takes, and do 5.5 seconds in, hold for 5.5 seconds, and push out for 5.5 seconds and hold, and just see actually how long that is, because it's a lot. I'm with Amber. I tried earlier and I was like, well, yeah, it takes forever. So I think we should all do it. Can we?
Andy, we got it. Let's do it. Andy, you do the timer. You give us the go.
Ready? And let's go. We're going to breathe in 5.5, hold 5.5, out 5.5, hold, and hold. And out. And hold. I mean, that's one breath cycle.
I'm relaxed.
Right.
I feel like a nap.
Hey, I just lost 5 pounds.
Guys,
just came up to 1,100 and I lost 5 pounds.
To the listeners out there, breathe through your nose, not your mouth. If you have a chance, go to our YouTube channel. The Dr. Rogers does a little explanation of the tape on your mouth if you're wanting to nose breathe at night to stop snoring, which is super helpful. We've got some amazing feedback from that, so go check that out. Amber in Kingsport, Kara in Knoxville, Fran in Johnson City, Andy in Johnson City. Guys, thank you so much for taking the time today to hang out with us. To the listeners out there, thank you for hanging with us. And as always, we will be back next week. Thanks, guys.
Bye. Have a good day.
Great. Thank you. That was awesome.